All right, welcome to HIVE Nurse, Inside the Hive podcast, where we are helping implement viable ecosystems through our work in discussing today's profession in healthcare, nursing, and beyond. I'm Ashley Kellish, and I'm here with my great friend and colleague.
I'm Elizabeth Walters.
We're very excited to be here with you today.
This is her episode, guys.
I am so excited. Can you see me grinning from ear to ear?
I could see rainbows shooting out of her ears.
Everywhere. This is the positivity potpourri episode where we really say, okay,
sure.
We know we talk a lot about the bad stuff, the burnout, the moral injury. It's real. We're not going to displace any of that at all. But there's also some really amazing and good things going on out there. And there are some environments that you can work in that are not toxic, that are innovative, and that there are cultures that we just want to capture out there.
Are you saying that there are healthy teams that exist?
There are healthy teams and healthy work environments.
Don't believe you.
And there's even ways to measure that as well, too.
Oh, of course there is.
Yes,
nerdy nurses, right?
Yes.
So I'm going to go ahead and set the stage about all of our evidence, right? Us nerdy nurses. In 2025, studies highlighted 5 key traits of non-toxic or healthy workplaces.
Tell me more.
They are supportive. They have supportive and emotionally intelligent leaders who are accountable. So very different than what we were experiencing in the last podcast.
Yes.
There is prioritization of mental health and structured wellness programs. So there is a yoga class you can take if you really want to.
Yeah, but probably during your shift, right? And during the
Wouldn't that
workday.
be amazing
Yes.
if you could do yoga while you're at work?
Yes.
I mean, I don't know if the patients would like the way I smelled when I came back from yoga at work.
It's true.
But, that would be kind of fun. There is clear, respectful communication with a zero tolerance for harassment.
Clear as kind.
No harassment. This is me. I love this. There's flexible scheduling and autonomy, right? Which directly improves retention. So I get to tell you when I'm going to work, not the opposite, right? So I'm I'm not going to work every Saturday night. I'm going to get some Saturday nights to doom scroll in my bed with my 17 pillows. And then there's meaningful recognition, right? So
keyword is meaningful.
Meaningful, right? So it's asking the person how they want to be recognized, right? I'm the opposite. I do not want anybody to say anything publicly about me ever.
But you're amazing.
Okay. Rainbows. Lots of rainbows. And these high functioning teams, they have all the things that we've been talking about, right? They have psychological safety, trust, role clarity, and shared purpose, right? All working for my personal shared purpose, which is for the patients, right? And so we're all working for the same thing. One study in 2023 found that teams with strong teamwork scored significantly higher in patient-centered care. And that CHEST framework confirms that team culture, which is built on communication, respect, and shared goals, improves safety and reduces turnover.
Yes, it's true.
And turnover is crazy expensive for healthcare systems.
Yes, it is. It's $60,000 to $100,000 per nurse, and that depends on your geographical area.
It'd be nice if they gave me $100,000. I would stay for that.
Every time you leave.
Yeah.
Yes.
I do leave a lot. So I'm going to talk a little bit about just one of my stories about a team that did it. The team, this was the dream team, best team I ever worked with. So in my own really small adolescent medicine practice as a nurse practitioner, it just started with me and a physician. And we were gung-ho. We wanted to do all the things. We wanted to take care of the patients. We wanted to grow the program. We wanted to develop an inpatient consult service. So we did that. We were able to grow our team. We grew into 4 providers, a nurse, and 2 mental health experts. They were both social workers. Even though we still experienced challenges, right? We had lots of maternity leaves, which was fun and exciting. Not my own, thank goodness. And there were some personal health crises, and there were periods of burnout, right? There were periods where a provider got burned out and just needed a break, and we covered that for each other. We supported each other. The focus was always on the patients. The focus was never on us personally. It was always on our patients. and our workroom was constantly full of laughter. We were always having fun. Even though the work was not that easy, we were just having fun. We were laughing, we were making jokes, and it was because we trusted each other to share that load. So that's what a healthy hive feels like. Do you have any particular stories?
Yes. I have so many, because in reality, whenever I have been able to lead a team, I have turned it into this viable ecosystem, this healthy hive.
Don't brag.
I am bragging 100% on this one, because this is what I do and this is what I do best.
She does do a pretty good job.
And it all comes back to these evidence-based strategies that we've been talking about: being visible, being open and honest and transparent, creating psychologically safe spaces for people to speak up and share ideas. Honestly, to me, that's my center. And that ultimately gets to better patient care. But when I am leading a team, I actually guide them through that very purposefully, very intentionally on, I'm going to give you space for where, when, and how you're going to share what's not going well. And then we're going to do something about it.
Yeah.
And it's not always me. I also put it back on the teams I'm working with.
Yeah.
And I find out what they're interested in, and they go back and help to fix the things.
So it's not a constant complaint circle?
No, they actually get to create the environments that they want to work in. They get to be a part of it. And that can be so meaningful to our teams when they feel like they're a part of the solution. Because guess what? They're not children. These are adults with really smart brains. Yes. And really good ideas.
Yes.
And they want to be able to offer ways to get to that dream team that you were talking about there. So, I love that.
So tell me, how do you, like, if let's say you're a new grad nurse, right? Yeah. And you're looking for an environment like this, or you're a new graduate nurse practitioner, and you're looking for a team like this, what do you look for? How do you know that a team is psychologically safe?
Laughter, number one. That's huge. I think if I had the opportunity, first of all, as a new grad, you have to make sure that you actually go and interview, and you actually ask to spend some time on the team physically before you finish out that day in that interview. So I often tell people, wear your scrubs, right? Yeah. Ask if you can spend 3 or 4 hours shadowing one of the nurses.
Get really fancy Hive Nurse scrubs.
Oh yeah, we should try and get some swag for everybody with these.
Yes.
But just, spend some time out there so that you can engage and see and feel. You can feel a vibe when you walk onto a team. Watch how the physicians interact with the nurses with the clinical nurse assistants or the unit secretaries, whatever that you have there, certified nursing assistants. Go there and watch it and listen and take stock. I actually did this with a new grad recently. She interviewed in 3 different hospitals, and I helped her get a shadow experience in each one of those organizations.
Yeah, you got a shadow.
And by the time she got to the 3rd one, she knew what she was looking for. And she felt a sense of team. She felt transparency. She saw rounds where people spoke up and shared things that were difficult. She saw people help each other out.
Yeah.
She was introduced. People introduced her as a person. They didn't just say, oh, this is someone interviewing here. They actually said who she was and what she was. And she found the team she wanted to ultimately work with.
What did she choose? What specialty?
Chose neuro ICU.
Oh.
She loves neuro ICU.
Oh, okay.
Yeah, she's been a nursing assistant in a particular unit for several years, and she has been through some very challenging, difficult patients. But because she's always felt part of a team,
difficult.
Yes, she's felt part of a team, and she's wanted to continue that work and go back.
That's amazing.
And she's going to be an incredible nurse as she continues in her profession.
Yeah.
But it's up to us creating these hives and calling for what we want. I think some of the things that I purposefully do as a leader is I create huddles, I create very intentional staff meetings, I create newsletters, and I create opportunities for people to share the smallest of wins so that we are constantly rainbows and celebrating.
It's always rainbows
and
there.
Bringing things up to the surface.
Yeah.
And we use gratitude too as a means. And there is evidence to support that gratitude changes your brain.
It's true. I do like it when somebody has a candy jar in the unit, and somebody will go and purposely bring it to you in your workspace and say, hey, here's a Reese cup. I know you like Reese cups.
Yeah, I thought of you. Yes.
Yeah.
You feel
I love
seen.
That. Yeah.
I mean, we often talk about that in today's life in general with our generations. We want to feel seen and heard. Well, we want to feel seen and heard in the workplace. When you go into a patient's room, it's just you and them.
Yes.
No one else knows what goes on in there sometimes.
Not other than the the ducklings that follow me into the room, which would be like the nurse practitioner students. And
yes, and they're observing that and seeing it.
Yeah.
But isn't it nice when your leader comes and says, hey, Elizabeth, I know that you've had a hard time caring for that patient, but you're doing a really good job. And it means something.
It does. I'm not a big fan of all the rainbows, but like a little pat on the back is appreciated every once in a while.
Hey, Elizabeth, I just want you to know that our outcomes are better because you're here. You would like that.
I would like that. If they had data to suggest that I was the reason for something happening.
Or a part of that reason.
Yeah, I would be all over that. If they had a run chart and it said, this is when Elizabeth started.
and here we
go.
Yes.
Yeah,
yes.
I would totally.
Or our infection rate went down.
Yeah, I would totally. I would wear that as a badge of honor on my chest.
But you know what? I bet a lot of people would. And that's the other thing is as a leader, connecting the work. So everything from falls and infections and things that sometimes nurses don't even know that they're directly impacting.
Yeah.
So figuring out how am I telling them about this? How am I teaching them about run charts and how to run this data and how to understand their impact?
Yes.
All of that is what creates
data.
these amazing environments where people feel like they have a part of what they do. You know, even when I've led education teams, we have run charts and we have data and dashboards and we have metrics that we're following.
Yeah, I know that because I'm the one that's doing those charts for you.
Thank you so much. Keep it up. But those are actually what make people feel connected to the work that they're doing.
It's true. Do you have any tips on how to build or protect healthy hives?
Yes. When you know you have it, call it out all the time. So I am always saying, I am so grateful to be on this team. I am so glad we're willing to share. Even when things are hard, like when you talked about on your team, when difficult times come up.
Yeah.
Those are the times you say it the most. Like, this is a difficult time, but I'm so glad that we're able to pull together
totally.
and keep working through this.
During that time when we had some of those maternity leaves, we were going from 4 providers down to 2, and we had an active inpatient consult service. And my one of my teammates and I covered the entire summer's worth of call.
Wow!
But we had a great time doing it. You know,
it's the grit, and you probably felt proud of what you were doing.
We killed it. We were making it happen, and our patients were well taken care of. And they had no idea that the entire team, 50% of the team, was on maternity leave.
Wow!
Which was really kind of fun too, because there were babies, and we got to see and squish babies. So
that's when you just love the work that you're doing and the team you're with. Recently, I was leading a big team. I had about 80 people. They were all in different quality and education roles. And we did our first big professional practice day, if you will, where we were changing kind of how we trained the rest of the organization. And it was big. We had 3,500 people that we had to get through in a short amount of time. So you know what I did to show them solidarity?
You had a pizza party.
We probably did eat pizza, but not for that reason. I went there. I went and taught with them. I put my name on the schedule, and I'll never forget a month in, one of them looked at me and said, thank you. You are the first person in this role to ever come and teach with us. And we've got it from here. We can take it now. You don't have to put your name on the schedule because we know you have other things you have to deal with. But that right there changed their entire team, how the team functioned from there on out. They knew that at the end of the day, if I had to cover, I went in on a Saturday and did it with them.
Yes.
Anything I could to show them that we're in this together. And that's what builds a healthy team.
Yeah, totally. When your leaders show up and do the things I love it when you're in the ICU and you have some sort of emergency and your whole team comes together after the emergency to do a little debrief, right? And it's like, this is the place where we're safe. We're allowed to talk about what went well, what didn't go well, what we should do differently next time.
And when your manager, your assistant manager, your director are leading those debriefs and those huddles in a safe way, that's when you actually create that environment again and again, because you're modeling the behavior you want to see. And that's what Hive is all about. How do we put out there the behaviors and the values and the core strategies that you can take to make those healthy environments?
100%. All right. Well, healthy teams, they don't happen by chance. They happen when leaders and staff decide to build them together.
And that's where helping implement viable ecosystems and Hive Nurse comes into play. And so we're thrilled to have this more positive discussion with you because we know it's happening out there and we want to hear even more stories of healthy environments that are existing so that we can really call out these strategies for people.
She wants to have a podcast like this every day.
Yes.
Just all the rainbows and butterflies.
Yes. No, but we have to talk about the hard stuff too.
I love that stuff.
Yes, we do.
Yeah.
Well, thank you for listening to Hive Nurse. Doom and Gloom and Rainbows and Butterflies, our new nicknames. But we appreciate it and follow us on all the social medias.
Yep. We got an Instagram. We have a TikTok. We would love to have people tag us in your posts and videos. It would be really exciting to have. We have 1 follower right now.
No, I think we're up to 2.
Oh, we have 2 followers right now. So we're really popular.
The Hive is growing. We want you a part of it. Thanks for listening.
Thanks.